welcome back to another video. Today I wanted to talk about TMJD, which stands for temporomandibular joint disorder or dysfunction. So this is a condition that is pretty neglected in fibro patients, but is actually quite common also in fibro patients. Often doctors think that it just is part of the package of fibro, so that's why it gets ignored a lot of the times. On top of that, nobody really agrees as to what specialty should be dealing with this, because most doctors think that it is a dental problem and most dentists think that it is a muscular or joint problem, so they don't know how to treat it, and it just gets a little bit confusing and frustrating for the patients. It's actually really hard to define the true number of people who are suffering with TMJD, because a lot of them have fibro also or have other conditions. A lot of them don't also, but it's just difficult because there's a lot of people who are probably not diagnosed, so it becomes a little bit difficult to find numbers. But the estimates that I have found through my research were that about 90% of people with fibro experience facial or jaw pain, and about 75% of those people have TMJD even if they don't know it. Also, through my research, I found a lot of forums and Facebook posts and groups and Instagram posts where people are discussing this topic, and it does seem like a large number of people experience some symptoms or are fully aware that they have TMJD. So what is TMJD? It is split into two types, and the first type being joint TMJD and the second type being muscular TMJD. So first let's talk about joint TMJD. This is caused by damage to the cartilage, ligaments, or discs, or any other part of the joint itself, of the temporomandibular joint, which is this one here next to your ear. Oh, that really hurts. That is used to open and close your mouth. So any kind of damage to the ligaments, cartilage, disc, or the joint itself would be causing joint TMJD. It can be caused by, for example, a previous injury, dental problems. It can be caused by grinding of the teeth, or bruxism, which is actually really common in people with fibro as well. And normally it presents as popping or clicking of the joint, inability to open and close your mouth very wide, not close. Inability to open your mouth very wide, pain around this area, and headaches. So for muscular TMJD is the type that is most commonly found in people with fibro. It basically affects the muscles that are used to chew, to move your face, move your scalp, the muscles that go down to your neck and down to your shoulders and back. So that is probably one of the reasons why it's very common in people with fibro. Muscular TMJD can be caused by sleep deprivation, stress, trauma to the muscles, psychological trauma, and lastly, it can be caused by problems with neurotransmitters in the brain, which, if you have fibromyalgia, sounds incredibly familiar because it affects the way your body and our brain interprets pain and basically makes it so that there's pain where there shouldn't be. And this type of TMJD can present as headaches, difficulty opening and closing your mouth, and pain also. So although I briefly touch on a few of the symptoms in these two descriptions, there are more symptoms that come with TMJD. So the first one would be pain in your face and jaw, and normally the pain in your face will be concentrated in this area, but obviously it can be other places too because all of the muscles are connected. It can cause headaches, like I have said before, difficulty opening and closing your mouth, like we also have already mentioned, pain in your shoulders, neck, and back, so the top here, where your neck sort of goes down, all around your neck, and all the way to your shoulders. It can cause tinnitus, which is ringing in your ears. It can also cause dizziness, difficulty chewing, blurred or double vision, vertigo and nausea, grinding of the teeth or bruxism, hearing problems, and lastly, pain in front of your ears. So it would be around here. In other cases, it can also cause ear inflammation because your joint is very close to your ear canal, and if it isn't working properly, it can rub against your ear canal and then cause inflammation in your ears, which happened to me. For both fibro and TMJD, stress is a major factor. We know this, we've heard it a million times. The reason why it's a major factor for TMJD in particular is because it can cause teeth clenching, grinding. It can cause, other things that you do out of stress, other habits where you're basically creating tension in your jaw, joints, and muscles. And if this is like a habit that you have that is continued, it will make your joints and it'll make your joint and muscular TMJD worse. Controlling stress levels is really important. Improving your sleep routines, as well as taking other kind of self-care steps can really help reduce the symptoms. The treatments should obviously be tailored to you and to your condition specifically, and especially if you have fibro and TMJD, you should definitely tell that to the people or the doctors who are treating you, because it is really important. It's a really important factor to know that you also have fibro, because the treatment sort of shifts a little bit. Because so far I have received massages for my TMJD, like on the facial muscles and neck and shoulders, and it hasn't caused a flare at all. So, but also I do notice that she is very gentle, and she tells me that she's not pushing me as hard as she would a normal person, because she doesn't want to cause me to, give me a flare. Dental intervention may also be advised, because if you are a teeth grinder, or if you clench your teeth or something, there could be damage to your teeth as well as everything else that's already happening, and that is also my case. So you can speak to your dentist. In a lot of cases, a mouth guard is made so that you put it on when you're sleeping, and even though you may still do the movement of grinding your teeth, you won't be wearing your teeth away. I noticed that since I've started using my mouth guard, I don't grind as much, but I still clench. So, you can't have everything. The best approach is basically a multidisciplinary team. So in my personal experience, I've always been a teeth grinder. I've had, it's called bruxism. It's not just teeth grinding, it's also clenching. It's like pushing your tongue against your teeth really hard, and other behaviors that are not necessarily stress related, but normally stress related. But for me, I was always an anxious person. I've always had anxiety ever since I was little. And when I was little, I started grinding my teeth. I've always grinded my teeth for as long as I can remember. And it wasn't something that I knew was related to stress. And I think that by now, it is worse when I'm stressed out, but it's not like a stress thing. It's just something that I have always done. So my body is just doing it automatically. Like with everything else, it got worse with fibro. So I started grinding my teeth a lot more and a lot more loudly, and I would wake up in pain. After a little while, I started having headaches. I started having a sore throat every single day, and it got to the point where my ears started hurting, and I thought these were all isolated symptoms. I told them to one of my rheumatologists, who said, yeah, that's normal, don't worry about it. And then I went to another rheumatologist, and I told her about my earaches and my sore throat, and the fact that sometimes this bone or this sort of section of my face hurts so much that I get impossible migraines. And she told me that I should definitely go and see an ENT. The one who found out that my jaw joint sort of pops out of place when I open and close my mouth. So he thought that that was the reason why I was getting earaches and why I was getting sore throats, because everything was really tense. And I told him that I grinded my teeth when he asked, and he told me to see a dentist about my teeth grinding, and I did that too. My dentist made me a mouth guard, which I've been using for almost a month now. Found it very uncomfortable at first, now not so much. After I saw my dentist, he also told me that he was a little bit worried about the effect that would have on my joints. He also told me that, you know, it should help a little bit, but there was only so much that he could do. After that, my mom found a leaflet for treatment of problems with your jaw, and you know, people, if like in the leaflet it asked like, do you have headaches, da 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 da. And so I decided to go and check out this treatment. It's done with a physiotherapist who is a specialist in this technique and in this you know, TMJD problem. And she basically told me that the fact that I have bruxism, the fact that I have fibro, and the fact that my joint isn't working properly, everything is like working against me, basically. What else is new? In this joint, apparently, there's a disc in between the two moving parts, which like sort of helps them work properly. My disc on this side has moved to a bad position, and I think it's pretty permanent. So the reason why this is dangerous is that because my joints are working so hard to open and close my mouth, what could happen is that with enough time and enough, you know, strain on the joint, one day I could get lockjaw. And this means that you can't open or close your mouth. You know, imagine you open your mouth and then you can't close it, or vice versa. And I don't want that to happen. I don't want to be in pain. You know, I have headaches all the time, earaches all the time, sore throats all the time, and it's just like, and I constantly feel tension in these muscles and my neck and my shoulders. And you know, if you also have fibro, it's so frustrating to be in pain all the time. And you already have so many symptoms, and there's just other thing now that is adding to it, and it's just too much. You just want it to, you just want something to be a little bit less intense. So that's why I'm trying out this treatment and this sort of physiotherapy. Basically, she massages my muscles, so around my head and my face and my neck and shoulders, and she even goes on the inside of my cheek and like massages from the inside because there's muscle there too. And she always says that everything is super tense and it hurts a lot, but I am aware that, like I said before, she doesn't do it as thoroughly as she would normally because she doesn't want to hurt me, and that's very appreciated from my part. What happens now, I don't know. I have exercises that she gave me to do, and I have to do those 3 times a day. I sometimes forget. I don't really have a conclusion yet. I don't know if it's working or not, but I am at least aware that this is happening, and that can help me sort of try to contradict the teeth clenching and the grinding every day now when I am working or when I'm doing something and I realize that I have a lot of tension there. I try to relax, and although this takes a long time to contradict these kinds of behaviors, my physiotherapist and I both agree that with enough time, if I constantly go against these behaviors and try to change them, eventually I will be able to. So it's like one of those things that just takes a long time, and especially with fibro, our muscles just take longer to react to treatment, and it takes longer for like everything to happen, everything that's good, and all the bad things happen really quickly. So, you know, you just have to be really patient, and you have to work really hard on it. I have no idea if my joint is gonna go back into its place or not, but I'm hoping that with everything else that I'm doing, I am going to, even if it doesn't go back to place, at least it won't be in as much strain and I won't be in as much pain. That even rhymed and everything. Oh, that's lovely. On that note, I want to end this. So I hope you enjoyed this video. I hope it was informative. That was the point today. And if you also have TMJD or whatever, let me know in the comments. I'd love to talk to you about it and to like hear other people's experience. If you did enjoy this video, leave it a like, and like I said, comment so I know that you liked it, and consider subscribing to my channel. It would mean so much to me. It would make me so happy. I will see you in the next video. Bye.